Welcome back to our global audience. Thank you for spending the time with us here today. And a very special thank you to General Alexander for spending some of your time with us to share your thoughts and knowledge that can help us in this really challenging time. You know, General Alexander, one of the questions I think that we're all wondering is what is it that you've learned from your experiences in national security that we could apply to meeting the challenge of dealing with COVID?
Well, thanks, Dr. Meyer. First, thanks for your service, and more importantly, to the audience. Thanks for all you're doing to help the world recover from the coronavirus. Greatly appreciated. It's a big undertaking, and it does have some similarities to what I went through in my time as the director of the National Security Agency and the commander of U.S. Cyber Command. When you think about how we operate and what we do, it's collective. You know, right now, when you think about working together for the common good, collective defense, both in COVID, sharing what we learned across everything as quickly as we can, and sharing it with others so that they know what we learned right away, is really what I learned in terms of the collective defense for cybersecurity. Specifically, if you think about cybersecurity, every company out there defends itself. And in doing that, they are attacked piecemeal. That's the first issue that I see. And if you think about that, it's almost what we see in the virus. And I'll come back to that in a minute. And the second part is, imagine if all those companies could work together at network speed to understand who's attacking them and share that information for collective defense. Two issues that we run up against. And it's really important to see the commonality, the synergy between what I talk about in cybersecurity and what you see in the medical community. Because we talk about signature-based, those things that I know. And if you know a virus and you know the solution to it, you can create a vaccine. The issue with COVID is there's a lot we don't know. So now you're dealing with behaviors. And even some of those behaviors are not well defined. We're learning as we go. It's the same thing in network security and protecting our infrastructure. So you have to have some way of determining the behaviors that go with it and tracking those. And finally, speed. It's all about speed and stopping the virus and getting people to isolate quickly and keeping the new cases down. It's all about speed. And if you think about defense, it's bringing all that data together, understanding how attacks are going on, and sharing that across a wide spectrum of sectors, states, and nations. Does that make sense, Gregg?
Oh, that makes complete sense. And I think one of the things that we want to make sure that we don't lose is that ability to learn from other experiences outside of healthcare. And that notion of creating a network and creating speed are just so important to what we're dealing with today. And I guess the question for you is how did you achieve that in your world of cybersecurity? And, you know, in terms of getting that network of peers working together on a common problem, maybe when there might be potential issues in terms of turf and intellectual property and the rest, how do you get that done and how do you get it done quickly?
So, you know, that is a big issue that I see companies starting to address themselves. It used to be, I am worried about my attribution, somebody saying, oh, it's a reputational risk or a liability. How do you step beyond that in cybersecurity? And what are we going to do? It's the same thing if you think about in defending for viruses and stuff. In this case, for us, what we learned is you've got to put that information together and go quickly. And there will be things that happen that we don't know are bad. But the intent is if you can share that information and see that bad starting to spread throughout a number of different computer systems or companies, you can really get a handle on this is bad or that's odd, and there's something we should do about it. And it's very similar if you think about the COVID issues that you face. You have these startups. Now the issue will be how do we test? How do we get enough contact tracing? How do we understand where the virus is so that we can quickly isolate and keep it from flaring up? Well, it's the same thing in network defense. If we know something bad is happening and we can get it earlier, it's better. Unfortunately, in the past, it's been 90 to 100 days before we understand there's an infection in a computer network. Think about that. If it took us 90 days to understand that in the medical community, how disastrous that would be. We can see a few days, an impact of a few days in New York City. Think about 2 months. So what we do learn is speed matters. Getting good information about the infection matters, and coming up with new ways of testing our defenses and the things that go into it matter.
You know, when you're speaking about getting good data and doing it quickly, it brings us to the topic of big data. And what it is that you've learned in your experiences at NSA and elsewhere about how we can pull that data together, how we can tag it and make it useful, how we can apply artificial intelligence to it, that again, that we can learn from now in the healthcare sector.
That's a great question, Dr. Meyer, because if you think about it, what you face, especially in cancer research, most of the data that you get in on the human genome is unlabeled data. What that means is we don't know whether it's good or bad. It's just data about chromosomes. It's the human genome. And what we're trying to determine is there information in that genomic structure that trends towards cancer or gives a patient a higher probability of getting cancer. It's the same thing in cyber. What we try to do is we take behaviors of network traffic and say, is this behavior odd? Is it close enough to what an infection would be? A signature-based system would say, I know exactly what this infection looks like. A behavior says, I have enough variables now that I can now put around it a good, reasonable approach to say, I think it's bad and we ought to do something about it. So what you do is you take machine learning, add that to human learning, think of expert system and rules, and you take that machine learning and regression analysis, and you can do much faster, much better. It's the same thing that we're going to do in cancer research that you're going to do in understanding threats to networks. And I think, ironically, the synergy between network security and our own health security is huge. And this big data, as you bring up, Dr. Meyer, is perhaps one of the most important things. Right now, if you were to go out to the Cancer Research Center, the Human Genome Center, and look at it, the biggest issue they face, labeled data. If you look at network security with behavioral analytics, the biggest issue we face, labeled data. You don't have enough of it. So what you have to do is you have to take an expert system, you have to do the best you can, and then try to train models to then look at that data and label it. And humans need to come back and say if that's correct or not. It's time intensive, but as you get more and you get more people working together on it, the faster and the better we'll be. So this will be really important for this big data thing for addressing all those that hook back to our human genome. And I think AI, machine learning, that is part of the future for healthcare, coming up with solutions, cancer research, and all the great work many of the people out there are doing right now.
Yeah, I want to follow up on that whole notion of network security giving us insights into health security. One of the things that we're struggling with right now as a nation, and frankly internationally, is the real kind of dual challenge of this pandemic, and that is its human toll and its healthcare costs, as well as its economic toll, and trying to balance those and think about how we're going to reopen, how we're going to recover, how we're going to reimagine the way that we all live in the future in a kind of post-pandemic world. That there are probably some insights there from network security and from national security. Again, what is it that we can learn from your experiences there that will help guide us in what is going to be, I think, one of the most difficult decisions any of us have ever been involved with?
So I've dealt with a couple of the states on reopening. What do we do? How do we reopen? How do we do it safely? Here's my assessment right up front. What the healthcare community is doing is they're saying, look, we understand that we can't have flare-ups. We've got to keep this down, and there's a way to go about doing it. And that's through contact tracing, isolation for those that we find where flare-ups could start, and getting our hands around it quickly. There's a lot of healthcare professionals involved, and that's key to it. If you think about network security, it's very much the same. It's how do we now take information about a network and the behavior of that network and get that information so that we can get out in front of an infection in a way similar to what you would do in the medical community. So in the medical community, it's contact tracing, it's isolation, it's cure, it's going down that road. It's hopefully coming up with a vaccine. Now, the interesting part between the medical community and the network community is right now we're focused on COVID-19. Now, if you take the array of sicknesses that are out there and say all of those could be thrown at us, how do we now cure for all those and understand that? That's very much the same as what is going on against the network security folks. They're seeing threats from ransomware. You see a threat from somebody phishing against you. You see all these threats against the network. And what network security people have to do, take the behaviors, understand what that is, and get out in front of it. So we can learn a lot here. I think the greatest challenge for the medical community will be what happens if COVID morphs and there are multiple strains of it. Each is lethal, but each more difficult to solve and requiring independent vaccines. And what happens if that comes up next year and the year after and the year after? Because as you lay out, Dr. Meyer, this has had a huge economic toll on the world. It's put us back into a recession. How do you get out in front of that? And that's what the medical community in your area has to do. And that's what the cybersecurity community in my area has to do.
And I think we need to do all of that together. And I think one of the things that we really need to solve for together is how much are we willing to give up, should we give up, in terms of privacy in the name of having greater security? This is a vexing question. I think it's going to guide a lot of what we do. And contact tracing is one area that comes up often, is how much are we willing to give up?
You know, it's interesting. My experience coming out of 9/11, we were willing to give up a lot for the security of our nation. As time goes on, people are not quite as willing to give up some. Now, having said that, I think the most important thing is to understand what exactly are we giving up? Can we give up information without impacting our privacy, our civil liberties, and our own security? I think we can do both. And so what we need to do is craft how we share information without sharing the specifics of this information belongs to Dr. Meyer or Alexander or someone else. And so I think you can actually create that, but it requires us to go back to the people and explain exactly what we're going to share. So in network security, when we talk about sharing information, we're not talking about sharing personally identifiable information. We're not talking about sharing the content of communications. We're talking about sharing behaviors of threat data. We're talking about understanding when a network is at risk. And in reality, when you think about healthcare, what you're really talking about is sharing information, understand when different portions of our population are at risk. And we want to share that. We need to share that. And I think it's our responsibility to share that and do it in such a way that it protects our own civil liberties and privacy. I think you can do both. By explaining that to the people, I think we can make a huge jump forward. I believe that is very important for the future because people call it as I either have civil liberties and privacy or I have security or safety. And the answer is, well, actually, I think we can do both. In fact, we, the healthcare community, the cyber community, the defense community, and the national intel communities all should get together and say, we can do both. You know, taking anonymized genomic data and putting that down, while I understand it's unique to a person, but nobody understands who that really comes from. Isn't there a better way to share that faster, understanding where it is? And the answer is absolutely. And so I think we're learning a lot in sharing behavioral data. And what we found out after working a couple of years on sharing it through lawyers and stuff, there's a way to share that. I think we can do the same thing in the healthcare area.
You know, one of the things that I fully agree with is just that notion. It's a false choice, this security versus privacy. But there's another issue, and that is how do you protect, as you try to get these networks to work together on a common problem, how do you protect the intellectual property of, for example, the biopharmaceutical industry as we, again, go after this common problem? How do we ensure that as we try to work across many, many boundaries, that those lines are respected and that, frankly, that we maintain that motivation?
That's a very important point. And that's where we actually do come together. There's two areas, I think, where the cybersecurity community and the healthcare community are completely aligned. We have a responsibility to help protect you from cyber attacks and to protect intellectual property, especially for those companies out there that are creating unique solutions. You have hundreds or thousands of people right now working on a vaccine, and that information should be value back to your company. And therefore, the intellectual property that you create in coming up with that vaccine will help you go on to future investments in other vaccines. And we should ensure that that's secured. The issue will be that's at risk right now. You can see there's been alerts from our nation, the UK, Australia, from the Defense Department, Department of Homeland Security, Healthcare, Microsoft, and others that the healthcare community is at risk for both ransomware and for theft of intellectual property. Crime, stealing your intellectual property. And the answer to that is working together. And Dr. Meyer, I think this is where the health community could actually jump forward. When you think about today, every hospital out there is defending itself. And if you think about that, that's crazy. And the reason is you don't have the resources, you don't have the people, you don't have a common defense. If you took all the hospitals and said, why don't we put them under a framework where they can work together, have perhaps a managed service, providing security for the hospitals and for all the sensitive systems that they have, and do the same for the pharmaceuticals and those that are building intellectual property, the results would be a huge improvement in your security, your network security, your cyber security, to protect intellectual property and to withstand attacks from people, criminals that are doing the ransomware attacks. So from my perspective, this collective approach is the key in both cybersecurity, and I think it will also be the key in healthcare.
You know, that's an incredibly powerful vision of how we move forward. And I guess it leads me to the question of what should we be doing right now to try to prepare for the next crisis, right? It won't be COVID, it will be something different. But what should we be doing now? What is it, based on your experience, like here are the building blocks that we need to have in place so we can do much, much better next time?
I think there's two things. And we've mentioned these, but let me come back to them in this way. First, I think we have to work together. So if you think about your big pharmaceuticals, people say we share information. But if you think about air traffic control, they share information at speed on aircraft, on federal flights, on bad people out there. All of that information is visible to air traffic controllers to make sure airliners don't bump into each other in the sky. In cybersecurity, we don't share a real-time picture. We share artifacts after the fact. And network speed is so fast that by the time it's shared, it's often months after. So we have to build that real-time system. For the healthcare community, that's the hospitals, that's the pharmaceuticals, that's the suppliers, that's putting them all together and creating a collective defense so that they are secured at speed. So when these ransomware attackers start coming at hospitals, you can see where they're hitting. You can provide that information back to law enforcement and others, and they can take them down. Same thing for protecting intellectual property from nation states and others. That's huge. So we ought to be putting that together. We ought to create this collective defense. It's like we're doing in the human genome sector. The human genome facilities you have in the University of Chicago and elsewhere is by bringing that data and that research together and sharing. I think that's part of the future, Dr. Meyer.
General Alexander, thank you so much for spending some of your valuable time with us this afternoon, and a special thank you for your service. The insights that you've shared with us in terms of the parallels between security and what we're now facing in healthcare are incredibly powerful, and let's hope that we can all learn many of those lessons that you just shared so wisely with us. Thank you.